I'm Gina Ryan, Director of Hardin County Educational and Community Television, and welcome to this edition of Issues and Insights. Joining me today is one of our health professionals from our area, and she actually works for our school district. Amy Hall is the director of our nurses that work in our schools, and they are employed through Cumberland Family Medical Health. Thank you, Amy, for joining us today.
Thank you for having me.
First, tell me how many nurses are employed in our school district and where the locations are.
We have 22 school nurses, and they're at every school, elementary, middle, and high school.
Now, in addition to the nurses, we also have physician's assistants. Is that correct?
Nurse practitioners.
Nurse practitioners. And what are the two roles?
For nurse practitioner, they can do anything that, like, you go to a little clinic, or they can, see, diagnose, assess, order medicines, prescriptions, that kind of thing.
Great. And the nurses themselves, what can they do?
We can refer to our nurse practitioners. We can give over-the-counter medicines. We give kids daily meds. Check out injuries to see if we need to do anything further.
And normally when our students are in our schools, that's a pretty busy day, isn't it? So
yes.
On a regular school day when students are in the classrooms, what does that traffic look like?
Well, it just depends on the school. All of them are different, and some have a lot more students than others. But our nurses stay pretty busy, just in and out stuff every day.
I know that when we went on the non-traditional instruction days, that our district also published that if students had medications that were located at the schools, the parents could come and get those medications. Yes. Okay. In addition, though, we are providing a really unique service in that we're keeping some of our clinics open.
Yes.
So can you discuss what that looks like?
We have 3 nurse practitioners, and they have nurses with them that are open still. We have Karen Leeser and Lori Dodd at EC3. We have Cassie Curry and Lindsay Driscoll at John Hardin. And then we have Lindsay Holcomb and Chastity Begley at North Hardin. The clinics are open 8 to 3. We do walk-ins. You just go to the door, ring in, and say you need to see the nurse practitioner, and then they'll route you where you need to go, because we're trying to bypass office traffic. You can also call our number to get registered, and they'll give you a time if you would rather do that. It's 844-435-0900. And then we also offer, if you don't want to leave your house or you don't feel like you should, telehealth. So you would also just call the Healthy Kids Clinic, and they'll set you up with one of the practitioners. You download an app, a Zoom app, and then they'll chat with you on that, see what you need.
Now, for those that may not be familiar with telehealth, what is it?
Basically, it's almost like a FaceTime app. Then you would talk to the practitioner, give her your symptoms, see what's going on, and she can, if she thinks she may need something for a sinus infection or whatever. You of course can't do swabs or anything because you're not in person, but they can chat with you and order medicines if you think you need that.
Telehealth is something that is becoming really popular,
yes,
especially during this COVID-19 pandemic. And how does that really help, like you were discussing?
Well, there is this COVID-19 out there, which we don't test for, but there's also sinus infections, allergies are acting up, different everyday things that people need to be seen for, but may not feel like they want to be exposed to everything else that's out there. So it's a good opportunity to still see somebody and maybe get medicine if you need it, but stay safe and healthy at home.
Mm-hmm. Individuals that aren't signed up with your medical program, can they do that, and is that available online?
Yes,
possibly?
We'll see anybody. You don't have to be a student or staff or family member. Anyone can come to our clinics, and if you have your insurance card, bring that. They'll send that into our registration people that work in Russell County, and we'll get you taken care of.
Awesome. And so those school employees that have their insurance, they can come and see you as well.
Yes. Mm-hmm.
Okay. For individuals that are worried about COVID-19, which all of us are worried about this pandemic, what are some tips that you can share with parents and guardians in regards to their own household and just being in the community?
Well, as Governor Beshear is saying, don't go in the community if you don't have to. Only, essential things. Do the 6 foot, social distancing while you're out.
And I'll say that if you notice, we are 6 foot away. We are practicing and modeling what it is, and we're doing our little 6 foot dance as we walk from room to room. So that's really important, again, because of that point to point contact.
Right.
So, and what are some other?
Wash your hands 20 seconds. Sing the ABC song twice if you need to. Wipe down surfaces with, some Lysol, Clorox solution, whatever you have at home. Just, try not to spread. And that also helps, stop spread of the flu that's still out there, common colds, strep, all that. So it's all good practices to have, but especially now.
I was going to say maybe one of the positive things coming out of this is practicing better hygiene.
Right, yes.
And trying to keep your germs to yourself.
Right.
Now, with an individual that may be sick in the home, and is there something that they should do if they have other siblings in the home?
Keep an eye out for fevers and with everybody. If you're unsure, you can call your practitioner. You can always call us to get more advice of what to do. As the governor's saying, if you would normally not seek treatment, it's probably the same, don't seek treatment. But if you're unsure, just call the hotlines and they'll guide you on what you need to do.
A lot of people are worried, and they want to take a test to prove that they don't have it. But the whole thing is, even though you may test negative, that doesn't mean that you...
Right, we're still 14 days, you may be negative today and tomorrow will be positive. And the flu kind of acts that way too. If you test really early, you may be negative, but you still have the flu. So same thing with COVID-19. So just practice, safe hand washing, distancing. If you don't feel well, try to stay away from everybody, and hopefully we'll all get through this.
Mm-hmm. Some people may not understand the need for nurses in schools. I'm one of those big-time supporters. How does it help our school district?
Well, it takes, when our nurses are there, teachers can focus on their job, teaching, administration. You don't have to worry about, who's going to take care of the student that's sick or that maybe have an injury. So nurses are kind of vital in, keeping our kids healthy minds, healthy bodies. So they're a great asset to have.
I was going to say, you also administer things such as catheters and things along that line for those students that may have some disabilities.
Right.
So what are some of those special services?
If kids need catheterized, some of our students maybe have a G-tube or need some feeding support like that. So everybody, the nurses are trained. They also have some staff. They help to train staff in case they're absent. We don't have a float to go. So just, anything that our students need, we try to come up with a plan to take care of them.
I was going to say also injections, correct? Like daily or allergy?
Immunizations is a big thing. You may hear from, if your child's non-compliant right now, that's some of the things that our clinics are doing right now is calling just one student at a time, making sure nobody is sick, bringing one student in at a time and catching up those immunizations so we can all be compliant.
What are some of those immunizations? I mean, parents at home may not realize that.
The biggest ones that we're seeing that kids are non-compliant is Hep A, which is a fairly new series that we require. The MMR, meningococcal, those are the big ones. Some of the older kids need a HPV vaccine, so we offer all of that. Any vaccines, we offer that.
What about the chicken pox and the measles and the mumps, all those?
Yes, yes, MMRs, measles, mumps, rubella. And then varicella, we ask if they've been exposed to chicken pox or whatever, and then we can give them a vaccine if they need that.
Now, what about the flu shot?
Yes,
to children? Yes,
we have flu shot clinics. We can still give those now, but we make a day for each school, and we go around and it's mass flu shot day. The first kids have no idea what's happening. By the time we get to the last group of kids, everybody's tore up, but we get through it.
I was going to say, if you've never received a shot, as an aware person, I was going to say many of those shots are given when you're an infant and up to about the age of 3 or 4. With the flu shots, have you seen good response?
Yes.
Okay. But it is important that people can still get a flu shot now.
They sure can.
Because we're in the flu season.
Right. Even amidst the COVID-19 stuff, we are still in flu season.
I was going to say, how long does a flu season usually last?
March 31st is usually when we stop giving the flu shots. That can change from year to year. I'm not sure what's going to happen this year with all this new pandemic going on. But the shots doesn't always keep you from getting the flu, but it keeps you usually out of the hospital and you rebound quicker. My middle child had flu A and B and was playing basketball, the next day. So kids, it's helpful.
Mm-hmm. Now, for parents that are a little bit anxious about different shots and those types of things, what can you say to them to try to alleviate that anxiety?
CDC recommends it. There are risks to everything, but you got to look at the risk and the benefits to get being immunized is far outweigh the not.
Right, and it also helps with those students that sit next to that student in the classroom as well, if they've been immunized. What about the pneumonia or tetanus shot? Is that something that's available?
We do tetanus, yes. Pneumonia, we can give that. It's usually our older, maybe staff members or family members that want that. Most kids don't require that or aren't, have the risk factors for that. But yes, we offer those also. Okay.
The common symptoms for COVID-19 is very similar.
Right.
So let's talk about what's similar and then what the difference is.
Okay.
Okay.
From what I understand, similar, you run a fever, kind of feel achy, not feeling so good, maybe shortness of breath. Difference, I think, lots of times I've seen this leads to like a really bad pneumonia, where you can't keep your oxygen saturations up, and then of course you need hospitalized, whereas the common flu most of the time you don't.
And I know that it's been stressed over and over again that younger people usually get through this type of virus, can come through it pretty healthy.
Right.
But it can affect those even younger people that have certain types of issues. So what kinds of issues should parents be worried about?
Any child that's immunocompromised for any reason, chemo.
What about asthma?
Asthma is big on your lungs, diabetes, anything like that. Those kids, already have issues going on, so getting the virus may be more detrimental to them.
Really, if you have any kind of organ issue, something going on that way.
Right.
And probably if you are receiving a feeding tube as well.
Right, mm-hmm. Anything like that. Mm-hmm.
Yeah. That takes you to another level.
Another risk.
Concern and everything. With parents that may have a child that has sniffles and maybe running a slight fever, should they try to go ahead and, I know you said if you don't normally bring them in, don't bring them in, but I think that there's a heightened awareness. Oh my gosh, maybe it's worse.
Well, and it could, if it's worse, you're not sure, of course, call. The thing is, they're not going to test them if they don't fit in certain criteria. So then you've just taken them and exposed them to other things, maybe. But if you're unsure, just call. There's hotlines. Call that, and they'll guide you.
Okay. I have never asked this, but in regards to scrapes and bruises, open wounds, is that something that
like a dressing open?
Right.
Yes, if we had a doctor's order, if a student had something going on, we could follow doctor's orders and do that.
Okay. What about those, I'm going to call the glue stitches? Is that something you can do?
Yeah, our practitioners can glue. Mm-hmm.
Okay, so if you've got a big gash or something like that,
yes.
That's good for me to know. Yes. I sometimes have a little gash here and there in stumbling a little bit, just because I'm getting a little older and things. And shuffle my feet. For the audience at home, the nurses that are in the schools are so vital. You mentioned that it really lets the teachers stay as teachers in the classroom, but it also can lead parents to know that they have someone watching over their child. When the program first started, there was probably some hesitation with parents to trust that give and take. What can you say to encourage additional use of the nurse practitioners with Cumberland Health and the services that you now offer? Because it really could be a convenient avenue for parents, and it also keeps students in the classroom when we're in a normal classroom setting.
Yes, when students, you're not so sure, they're maybe not running a fever, they're not throwing up, but they just don't feel well. Maybe it's a sinus or an ear infection. It will keep them learning, and then our practitioner can come to them. It also keeps parents from having to miss a day's work for something like that, it's hard to get in sometimes in the clinics. And so what happens is our school nurse sees the child and speaks to the parent. They never refer without talking to the guardian. And then we put them on the provider's list, and then they, by priority, will go through and see everybody before the end of the school day.
And you said it's really an open clinic.
Yeah.
Okay, so you can come to the clinics that are currently open.
Yes.
Even though you're not presently registered
right.
as a patient there. And you talk about various payments. What types of payments can you receive? In addition to cash, probably. But
yeah. Well, at the clinics, we don't do any, they'll ask for your insurance card and they'll just refer that to the registration people. All insurances are accepted. And then even if you don't have insurance, we will turn no one away. They work with you. There's programs, there's sliding scale fee programs, there's different things that we work with. So if you don't have insurance, and don't worry about that. Come in and see us if you need to be seen.
And with the nurse practitioner, she can also prescribe medications as well?
Yes.
Okay.
If she feels like she needs an antibiotic or steroid, or she can give injections if it's something that she may need to give a injection that day for. We offer all of that.
Okay. Since we've been open during COVID-19, I'm sure that the walk-ins haven't been as high because, of course, Governor Beshear is saying stay home, which is a good thing.
Right.
But it is important for those of us that are still out in the community because it's necessary to provide information.
Right.
And so they can utilize the clinics as they are.
Just pull to the front doors, any of the EC3, John Hardin or North Hardin. Pull to the door, ring the doorbell. They'll ask what you're there for. You tell them you need to be seen by the nurse practitioner. They'll come out. They'll have the nurse practitioner or her nurse come and get you, and we'll take care of you.
Awesome. And just for those at home also, we do sanitize those things regularly, but also think about, hand sanitizer for yourself as well when you're traveling. We do wash down those buttons on those buzzers and the handles, which are metal. Right. And even though we have a lot of push doors that open, we have a lot of need to pull doors too. Is it advantageous to I do the sleeve effect, where I kind of pull my sleeve down and open doors. And of course, I've seen people with gloves on, with face masks on. Are those things that you feel might be advantageous?
The gloves, maybe, because you're touching things. The mask, may keep you from getting like the flu or a cold, but as far as COVID-19, that's the special N95 mask, from what I've understood and what I've read, and so I'm not sure that's really helping, but if it makes you feel better.
Right. Well, and I guess if you yourself have a cough or cold.
Yeah, and I guess if you're immunocompromised also, it wouldn't hurt not to get the other viruses and things that are out there. So.
Right. Now, age level, I think you said you could accept anybody.
Yep, we'll see anybody, babies to 112, we don't care.
Right. And all of the facilities that we're presently in are handicapped accessible, so you shouldn't have to worry about that. Now, during spring break, will the facilities be open?
No, we're 8 to 3, Monday through Friday, but we'll be closed spring break.
Right, so that means next week, which is spring break in Hardin County schools, the clinics will not be available, but they'll open back up on April 6th.
Yes.
As need be. And of course, I don't know if everyone does know, but Governor Beshear has asked for all school districts in the state to be closed at least through April 20th.
Right.
So that is something your service definitely can provide some extra assistance to those parents, because I'm assuming that some doctor's offices are going to be pretty busy.
Pretty busy, right. And only seeing, I think, maybe some are, seeing so many sick children that, there's only a limited number of spaces. So, we're there to help if we can.
Well, and another advantage to this, too, is that some of the students may know that nurse and may know that nurse practitioner.
Right.
Now, are they rotating the nurses and nurse practitioners?
No.
Okay.
The same ones we call them pods. That's their area. So that's where they will be.
Okay. During the course of the school year, since the program has been in place, I I know that Ibby has spoken at our school board meetings about the numbers of students that we serve, but on a regular school day, how many students do you think the nurses see? Well, and I know when we have, I mean, Central Hardin is a large student population, and some of our other schools may be smaller. So per average, probably 1-2 students an hour maybe?
Or more.
Or more?
Yes. I came from JTA, and we were the busiest, even though our numbers are not anything like North Hardin or Central Hardin. But
I think it has to do with those middle school kids.
Middle schools seem to be super busy. But yeah, average a day, probably 25 to 30 kids a day would be average, I would assume. I've never really looked at it, so that's something I might check into.
Well, and by school to school, I'm assuming some of the things are very similar, but they could be very different too.
Yeah.
In regards to high school students, middle school students, and elementary.
Different issues, yeah.
Right. Especially I'm thinking about pulled muscles and athletic.
When they're doing like gym or conditioning in high schools, we see more of that. Little kids, we see a lot of bump my head or, scrape my knee on the playground or whatever. So yeah, it's all different.
We've done really well with keeping our schools in check when it comes to allergies. And it seems now we have more students with allergies than ever before.
Right.
What are those common allergies that occur in our district?
The big one is peanuts. And so every school has a different way they deal with that. But the nurses keep the kids' EpiPens on hand. So if they need that, they know where that's at and they're there to help.
Besides peanut allergies, are there others?
Well, there's different medicines, things like that. Bee stings, that's a big one we usually see in spring when the bees are starting to come out and kids are outside more with gym and things. But I'd say peanuts is the biggest allergy. And
usually when teachers take their students on field trips, another thing that the nurses help do is train those teachers how to use EpiPens and just really make sure when they're traveling with the students in regards to food that if they need to have gluten-free or peanut, or what's another common food allergy? Just something was down the back of my mind, I can't remember, but there was another one that I had a student and they were highly they just could not eat that certain type of food. So we'd always have to go in and make sure.
Some milk, we've seen a lot of milk allergies.
That's what I was thinking,
yes.
Lactose intolerant. That's what I was trying to think of. I knew that there was another one. And like you said, at the schools, they know about it.
Right, and usually the cafeteria will have that pre-made lunch if the parents aren't sending it. But the teachers will send the nurse, hey, we're going on this field trip. Here's a list of kids. And the nurse in their office they start from the beginning of the school year. They keep a list of conditions that each child has and then medicines that they may need to take with them. And so they get that bag ready to hand off to the teachers.
I'm assuming, too, that there may be times when a student starts showing a symptoms or an allergy that wasn't known before.
Yeah, it can.
And having a nurse in that building, you can kindly spearhead that.
Right, and if we have permission forms on everybody, we offer Benadryl, which usually is the first line to stop with allergies. And we can call the parents or guardians, and if they need to see the provider, we'll set that up.
So tell us about, again, just to remind us, what locations and times and dates.
Okay. We have 3 locations currently, EC3, John Hardin High School and North Hardin High School, 8 to 3 every day, Monday through Friday, except for next week for spring break, they will be off.
Okay, and also phone number for telehealth.
Okay, you call telehealth or just to register, see how busy the practitioners are that day. If you want to kind of get an appointment time, they can set that up. It's 844-435-0900.
Now, if an individual does need a shot and they have their own medication, can they bring that in? Is that a possibility?
If we have doctor's orders along with that, yes.
Okay. We're going on our 2nd year of the program, and when the Cumberland Health sought us out, it was really a godsend. And our director of our Family Resource Youth Service Centers and our nurses, Janae Sutton, says it has just made a complete difference, and it's been so easy of a transition to work with this program. What can you tell people at home about Cumberland Health? Why is it such a great place?
It is an awesome opportunity to work for them. They care about kids, they care about their staff. like during this time, we're trying to do everything they can to keep everybody working if they want to be working. It's just a good place to work, and it offers great things for our kids in schools.
Well, and we want to appreciate all of those medical employees, no matter from cleaning the facilities to handling all the emergency and intensive care things, because you all are in the line of duty, and you are on the front lines when it comes to exposure, and you tackle anything that you're given. So we really appreciate that, and we appreciate that service. So again, if you need some medical assistance, you can visit our 3 schools, EC3, John Hardin High School, and North Hardin High School, and attend our Healthy Family Clinics. It's easy, and it keeps you out of the community that you may not need to get into, and it's all handicap accessible, and really it's a great thing to do to support the medical and health needs of our community. Thank you, Amy, for joining us.
Thank you for having me.
And thank you for joining us for this edition of Issues and Insights.